Thank you so much, Mary. Really very insightful, and thanks for the solutions you've put on the table. And definitely, I think we will need to come back to these solutions, collaboration between energy and health, improve demand forecast support planning at country level. These are critical issues that I believe will be worthy of further in-depth discussion as we move on in this panel discussion. So thank you so much, Mary, for that. And to address the same issue of key challenges that we have experienced so far, I would like to call on Mr. Patrick Tippoo, Head of Science and Innovation, Biovac, to give us his own reflections as well. Thank you, Mr.
Thank you very much. Can you hear me?
Very well.
Okay, excellent. I'm going to be sharing a few remarks from an African perspective, and more particularly from an African vaccine manufacturing perspective. And as per my introduction, I am a part of the AVMI, the African Vaccine Manufacturing Initiative. Now this, I think it's worth mentioning that this initiative was started about 10 years ago with this situation in mind that we're facing today. That some of us recognize that there was an urgent need then to do something about the capacity on the African continent to respond to emergency situations, such as we are experiencing today with respect to COVID-19. And I think this was supported by WHO and the Department of Human Health and Human Services in the US when they initiated the GAP program for influenza vaccine production capacity. And I think that we need to ask ourselves the question when it comes to lower middle income countries and Africa in particular, why do we want vaccine production? And I think that's the question that we had asked many years ago. And I think that the debate is over now. That we know that vaccine production is absolutely essential and a priority because it's the best route to securing access. If you make the product yourself, you can then control where it goes to, and we've seen that happen over and over again. So we know that the reality that we face today is that of the 1.5 billion doses of COVID-19 vaccine that has been utilized in the world, less than 2% has come to Africa. And if you contrast that with figures that have been bandied about for the US, that has been vaccinating around 1.5 million people per day, the situation then demonstrates a very, very stark contrast. And I think that I'd like to pick up on a point which Marie raised, and that is the market and the demand. And one of the reasons why the situation has persisted in the African continent for the last number of years is the market demand. Because while we focus on vaccine manufacturing and the inputs required to establish this capacity, I think it is important to appreciate that it's one thing establishing the capacity, getting access to the finance, building the skills, setting up the infrastructure, accessing technologies through partnerships, etc. But that's one side of the coin. The other side of the coin needs to be looked at, and I think, in my opinion, and this is the perspective that we share as AVMI, that the critical element that needs to be solved first is the market side of things, the demand certainty, because this speaks to sustainability. And we need to begin with the end in mind. that not only do we want to establish vaccine manufacturing capacity on the continent, but we also want to ensure that it is sustainable. And part of the challenge, as we've seen, given the tremendous work that Gavi and UNICEF have done, in that around 1.5 billion doses of vaccine come into the continent annually, and this is either on a partially subsidized or fully subsidized basis. But the reality is that distorts the market in Africa with respect to building commercially sustainable capacity, because 40 or more of the African countries depend on the supply of vaccines externally via UNICEF. So the market demand and the demand certainty that goes with that is a critical point, and I think that there is a realization by African governments, catalyzed and facilitated by the African CDC and the African Union, that governments on the continent now need to think differently. And this is not about getting vaccines cheaper, but in situations like this, as has been said before, it becomes an issue of national health security. And when one looks at it with that kind of perspective, then you approach it differently. And as has been said in the previous session, that the cost of investment now to establish production capacity on the continent is dwarfed by the cost of not doing it and being caught in the situation that we find ourselves in. I'm going to pause there, but I think that the key point for me to leave you with is the market demand and the need for African governments now to mobilize resources to ensure that this happens in the fastest possible way. Thank you.